Marcus Williams joins us now to talk about diabetes. That's a problem affecting a lot of people. Welcome, Marcus.
Thank you, Karen.
How prevalent? Great to have you. How prevalent is diabetes?
Well, diabetes affects a lot of people here in the United States. Even today, we have about 79 million people that are pre-diabetic, meaning that they don't even know that they're walking around and are at risk for the condition.
Okay.
But diabetes itself is potentially a life-threatening condition that is caused by imbalances of insulin in the body. We have three types of diabetes. You have type 1 diabetes, in which your pancreas is not producing any insulin at all, and you need to get insulin. You have type 2 diabetes, in which you have a condition which people might be able to produce some insulin, but not enough to usher the sugar into the muscles where they belong. We all need sugar. Sugar is kind of like the energy, where we initially get energy for our daily activities. And the third type of diabetes is gestational diabetes. That occurs in women that are primarily pregnant.
Okay.
It tends to go away afterwards.
Type 2 diabetes is the one that's oftentimes attributed to lifestyle and people that gain too much weight or sometimes drink too much alcohol, and then this condition can evolve into that. You brought along some fat, and I know that the fat has a lot to do with this. So tell us a little bit about, each one of these. Now this smaller one is actually, what is that considered to be, about 1 pound
That's
of fat?
about 1 pound of fat right here. And this is about a 5-pound model of fat. It's not real, so we didn't take it out of anybody's body, but it's a fat simulation model.
Okay.
And what Dr. Hemon has focused on over the past 21 years is he has realized that for every pound of fat that we tend to carry, our body tends to need an extra unit of insulin to help usher again that sugar into the muscles. Now, so if you get rid of this, that's one less unit that you need. And so what we have found over a period of time, that most of our patients that have come to us initially on insulin now have been able to go back to taking oral medication, which is really a big deal when you're talking about quality of life and less needle sticks and things of that nature.
Absolutely, and I know you guys at Island Doctors are totally equipped to handle diabetes. We have some photographs that you sent in of people getting, their blood pressure taken and so forth, because a lot of it is because of, oftentimes, of someone being overweight. I also know that Island Doctors has kind of like a 10-year plan, if you will. Explain to people exactly what you do at Island Doctors. What sets you apart?
Well, Island Doctors is family care physicians across Northeast Florida. We do have, currently have about 6 locations in the Clay and Duval County area. What we primarily focus on is the major risk factor for morbidity and mortality, which is heart disease. With that, you have 3 umbrellas: diabetes, hypertension, and cholesterol management. The philosophy of Island Doctors is that at each and every one of the visits that you come to see us, whether it's a walk-in visit for, an ear infection or something like that, cough or cold, or whether you are checking upon one of these conditions such as hypertension, diabetes, or cholesterol, that we address one of those components of heart disease so that, number one, both you and I know what our risk factors are, and number two, the provider or the physician and the patient have a plan in place on where they need to get.
Okay. So it's kind of, a long-range goal then, if you will.
Yeah, it's a continual long-range goal, but we like to consider ourselves more as healthcare coaches. We're physicians and providers, but we're also coaches to try to help meet you where you need to be.
And I'm pretty sure that these are the guys that if you call and you have a problem, they will see you the same day, so there's no waiting involved, right?
Well, let me just clarify on that.
Okay, maybe not.
I don't want you to come to our offices and you have to wait, but we do have patients that come to us under some of these programs. We do have if you're sick, you're seeing policy.
That's what I mean. So you kind of have a triage process going on. So
exactly.
if you're sick and you need to be seen, you can call them and you will get in.
Definitely.
Yeah. Okay.
Definitely. It is one of our policies.
Right.
You are.
All right. That's cool. What else would you like to add?
Well, I'd just like to add that, it's really all about awareness when we're talking about diabetes. Island Doctors is getting ready to launch a Decade of Health plan. Hopefully we'll do that with the city of Jacksonville. And diabetes is going to be probably year 2018. But, what we would like to do prior to that is to establish awareness about the disease before we get into actually trying to monitor the disease. So during the next 10 months, what Island Doctors is proposing to do is to team up with the city of Jacksonville, go to a lot of the events that seniors are at and participate in, such as the Mayor's Walk coming up in March.
Right, okay.
And just increase awareness about diabetes. Go ahead and give some screenings that will help people know what their glucose numbers are. And if we find that, their glucose numbers are not where they should be, we'll refer them back to their doctor, of course. But we just want to start the health dialogue so that people are thinking about it. And we're going to be out there in the community at these various places to try to engage them where they are.
I think that's fantastic, because basically you're, I guess, creating an awareness. You're getting the word out.
That's right.
All right. Listen, thanks so much for coming in and helping us out today.
Thank you, Karen.